I'll be talking about post-surgical ocular homeostasis, and uh, there are certain issues after successful surgery. Like you want, if you're doing a cataract surgery, you want a good visual outcome. So IOL should be well centered. Retinal surgery, you want the retina to be flat. Glaucoma surgery, you want the IOP to be normal. LASIK flap should be fine. So all these things you want as a surgeon. But the patient not only wants the vision, but also wants comforts. And symptoms like irritation, redness, foreign body sensation post-surgically is really very disturbing. And the cause of this symptom is a disturbed ocular surface homeostasis, and that is because of inadequate ocular surface hydration. Now, LASIK can cause dry eye by reducing the corneal sensation, by cutting the nerves, and some patients might be having a pre-existing dry eye. This is the neuronal loop that is there. When you do LASIK, you cut the nerves and the sensations don't travel to the brain, and then the secretomotor nerve impulses, they don't come to the lacrimal gland, and that's how the tear secretion reduces. And this is one survey which was conducted long back, and they found out that 21% of all those who are dissatisfied due to dry eye. So 1 out of 5 dissatisfied patients are because of dry eye. Cataract surgery can also lead to dry eye because of so many factors, because there are some preoperative factors like cataract patient population is old, has a high chance of preoperative dry eye, perimenopausal females, MGD, coexisting glaucoma, taking anti-glaucoma medication. And then when you do cataract surgery, you alter the corneal curvature, cut the nerves. There can be, you want to have the best results, so you want an arcuate, etc. Incision, which can further, cut the nerves, and all these factors can lead to dry eye. Then following glaucoma, again, there are various factors like you use antimitotic agent. There can be blebs that can cause disruption of the tear tear surface. And just hold on. Hello, sir, आप बता दीजिए. सर कुछ भी कर सकते हैं सर. Okay. So, when following retinal surgery, there can be corneal surface disruption. The retinal surgeons, due respect to them, but they, debride the epithelium. Sometimes the conjunctiva is also damaged. There's a study on phototoxicity of microscope also. Then this study wherein they showed that those patients wherein silicone oil was used, they had more chance of ocular surface disorder. And of course, drug toxicity can also lead to ocular surface disorder. And this is a terminology which is ocular OHHQ, ocular homeostasis quotient. So the things in the numerator, if they are high, then the value of OHHQ is high, and that is better as far as the comfort of the person is concerned. The management depends heavily on, of course, lubricants till date. And of course, there are many new things coming up, as was being discussed just now by Dr. Rohit Shetty also, regarding use of vitamin D. And then, of course, we use the lubricants. Amongst the lubricants, we have carboxymethyl cellulose, hyaluronic acid, and PVA, PVP combination, HP Gore combination. Then we have drugs to reduce inflammation like topical steroids, cyclosporin, and of course doxycycline and omega-3 fatty acids. So but these are some of the basic things about the post-surgical dry eye. But there are many emerging concepts, and one of the concepts that has, a couple of concepts have been discussed earlier, and one more concept is that UV rays causes apoptosis of ocular surface, and that results in ocular surface disorder. And chloroquine, which is an anti-malarial drug, by systemic use, accidentally people found out that it helped in dry eye and Sjogren's syndrome, and that's when people started thinking of use of topical chloroquine. And chloroquine, what it does, that it inhibits the metalloprotease release, and this may control apoptotic inflammatory cascade. And chloroquine provides photoprotection from UV rays. There have been experimental studies, there have been animal studies, as well as the human studies, to show the safety and efficacy of chloroquine in terms of reduction of apoptosis, in terms of reduction of inflammation, and in terms of improvement of symptoms of dry eye. And even at our center, we have done a study at RP Center done by Professor Tital et al. And found out that topical chloroquine is a useful adjunct to topical lubricant in management of dry eye disease, because it improved the parameters related to dry eye investigations. And a couple of studies done at Narayan Netralaya also by Dr. Rohit Shetty. Then I'll just move on to some newer polymers like Lefty Grass and Ribammipide. Now, Lefty Grass is something which is not available in India, but it is a lymphocyte function associated antigen antagonist, which prevents the adhesion, activation, migration, and proliferation of lymphocytes, which ultimately lead to cytokine secretion, cell destruction, and self-amplification of the inflammatory immune response that further aggravates symptoms of dry eye disease. Now, it is not available, the dose, it is just like cyclosporine. Basically, it reduces the inflammation, and it is like cyclosporine. And since it is not available in India, we don't have a personal experience, but it is available in US, and the cost is more or less the same as cyclosporine. And but so far, no studies have been done comparing Lefty Grass to cyclosporine, and no study has been done to see the additive effect of Lefty Grass. Then Ribammipide is another polymer which I would like to mention, which is a mucin secretagogue, and it is really useful in it contributes to stabilization of the tear fluid by serving as a scaffold for the localization of mucin. It prevents the damage to the microvilli, and that is an important thing. This is one thing which states that Ribammipide treatment damage to microvilli. Dr. Rishi, do I have a minute or two?
Yes, you have a couple of minutes, Rajesh, and then we have Vanati last.
Yeah. Okay. So Ribammipide, as I was mentioning, that it not only protects the microvilli, it increases the proliferation and thereby density of goblet cells as well. And that is how it protects the ocular surface. So it ensures firm adhesion and good stability of tear film over the ocular surface. And I'll just skip all this, and I will show this, that, Ribammipide not only stabilizes tear film, it proliferates goblet cells, it increases mucin production, it decreases tear hyperosmolarity, it decreases inflammatory mediators. So it has a 360-degree benefit in the management of dry eye syndrome, and that is quite useful. Now, a couple of studies have done, and human studies as well as animal studies, which have shown that it improves the symptoms related to dry eye and improves the repair of the ocular surface and health of ocular surface, and not only in dry eye, but it also helps in certain allergic conjunctivitis like VKCs or AKCs, wherein it reduces the giant papillae and thereby improves the health of the ocular surface. So, and as far as dosage is concerned, it is instilled 1 drop at a time, 4 times daily for 4 weeks, and it is reasonably safe, and that's why this polymer, which is really coming up quite fast and is being accepted by many people, is really very beneficial for protecting the ocular surface. So in conclusion, I would like to say that, in post-surgical dry eye, you have a whole lot of things wherein, it starts with the preservative-free lubricant to, improve the symptoms. Then, of course, topical cyclosporin or Lefty Grass or topical steroid to reduce the inflammation. Of course, patients might be having MGD. So omega-3 fatty acids, although there is one study which states that it doesn't have much benefit, but many of the studies have shown that it does have some benefit in MGD, and as mentioned by Dr. Rajiv Mukherjee. To prevent apoptosis, topical chloroquine phosphate has been used, and topical ribammipide is also an option. So we do have some polymers, we do have some additive agents, we do have many other things, and I still feel that we still have to know a lot more to actually understand the real mechanism of how things happen and what all are the newer stuffs that can help in improving the symptoms related to dry eye as well as health of the surface.
Thank you, Rajesh.